Hello everyone, my name is Dr. Joel Rosen and I'm here to talk to you about some things that we're doing for our fibromyalgia patients that are very frustrated. They're in pain, they have brain fog, they can't focus. Anywhere you touch in their body, they're sore. They're on medications that are trying to help but are not doing anything. They've been to their doctor, they've been told that nothing is wrong, and maybe they've even been told to take an antidepressant. So what I want to talk to you, and lastly, they've been told that their blood tests are normal. So what I want to do is I want to tell you that your blood tests probably aren't normal. It's just that the doctors are not running the appropriate tests. And we'll do tests like leaky gut test, we'll do hormone testing, we'll do food sensitivity testing, we'll do organic acid testing that looks at neurotransmitters and healthy bacteria and other inflammatory markers. But what I want to talk to you today is I want to talk to you about genetic testing. And one of the major things that I see with patients that have fibromyalgia is they're not making enough Sammy. Enough Sammy. And so maybe you've heard of the supplement Sammy, but basically Sammy is the second most abundant source of energy in the body. So the first one being ATP. You may have heard of ATP before. It's how our body makes energy from the food we eat. But Sammy is the second most abundant form. And what I'm going to tell you is basically Sammy has two things that it needs to do. It needs to make cell membrane function and muscle function. So think about what Sammy does. Sammy provides a lot of energy for our cell membranes. What are our cell membranes? Our cell membranes are a nice tough coating where all the energy production takes place. And if we have inflammation, if we have infections, if we have chemical exposures, if we have free radical damage, then what happens if we have bacteria overgrowth, all of this stuff will disrupt the cell membrane and it will break it down. So we're always trying to replenish the cell membrane. And when we have enough Sammy, we can do a good job of that. The other thing that the Sammy must provide is for muscle function. So muscle function is where all of the mitochondria particularly live, and that's where energy is being produced. So what I tell patients is Sammy has to pay 70% of its total demand for these two functions. And we have a really difficult time making Sammy if we have genetic weak links, if we have heavy metal exposures, if we eat a diet that's poor in folate, like leafy green vegetables, if we're eating a lot of processed foods, if we're not able to absorb B12, then we're going to have a lot of problems with Sammy production, and it's going to fall behind on the cell membrane and the muscle function. And how do I know if this is happening? Because you are dealing with fibromyalgia. You're dealing with muscle pain. The majority of the time, you're not making enough Sammy to make those muscles regenerate and heal better. So a lot of patients will say, well, can I just take Sammy and feel better? Yeah, you probably can, but Sammy has to do a lot of other things. It's got to pay a lot of other bills. And if Sammy is not being taken without fixing some of the other roadblocks like neurotransmitter problems, taking estrogen, having food reactivity, having bacteria overgrowth. If you're not going to fix all those things, then you're still going to suffer with potential anxiety, inflammation, bloating, pain. So the bottom line is I wanted to tell you that there's more going on than just your normal tests that are telling you that everything is okay. We do great work with fibromyalgia patients. I have a special right now. We usually charge $149 for 2 visits, but we're charging $99. I'll go through all of your blood work. We'll do a history talking about some of the environmental exposures or past medical influences that have impacted your health. And then we'll also do a neurological exam to see how well your brain is firing. And then we'll put together a recommendation. And most of the time I make a recommendation. I say, hey, let's go get a genetic test and see where you're breaking down, if you're making enough Sammy, if you have any weak links anywhere else, and let's fix you and get you better. So give my office a call. It's 561-883-0090, and I look forward to helping end your fibromyalgia nightmare. Thank you so much.